I'm sorry if I woke you up. I didn't mean to, but we actually need to have a really quick exam. Yeah, that will be some kind of a full body exam. I'm your nurse today, and I'll try to make sure everything is really quick and not too tiring, not too overwhelming for you. I know that you are supposed to have some good rest. That's what Dr. Eclipse taught me. Am I right? Sure. So I just came to make sure if everything is alright, if you feel really comfortable, if there's anything I can do for you. Okay. Can I get you some water maybe? Are you sure? Alright. Well, let me ask you just a few questions, okay? I'll just take some notes in the process, and then another nurse that comes in the morning, she will see all of this data and she'll be able to inspect you more thoroughly before Dr. Eclipse comes. So, the first question is that throughout the day, have you felt any dizziness? Okay. How bad was that? On the scale from 1 to 5, let's say. Okay. No, I got it. I understand. Please don't worry about that. We'll make it all work. It's just fine. Alright. Now the next question I have is, how have you been feeling in terms of your headache that you used to have? Have you had any? What kind of headache was that in such case? Was it mild? Was it really severe? Could you help me understand where it was located? Was it more like in your forehead, closer to your eyes? This area above your eyes, or maybe at the back of your head? What about your neck? It's all good. Have you had any nausea? Vomiting or anything related? Other symptoms related to your digestive system? No, I got it. Don't worry. That's alright. Like I said, no need to explain anything. So, yeah, I totally understand. You can trust me completely. You can tell me all the details you want. It's totally fine. That's why I'm here. Please don't be shy. Okay. Alright. I got it. Okay. Well, let's start the examination and then we'll see how it goes. Okay. And then I'll be able to ask you some more questions in the process if there's anything else I'd like to clarify on. I will flash some light in your eyes. I'm sorry about that, but I have to do that. Let me have a look at your pupils. Okay, once again. Please look up. And now look down. Now look to this side. And to the other side. Perfect. Thank you. Once again, look up. Then look down. Look to this side. And to the other side. Perfect. Thank you. Now I'll ask you to follow the light for me, okay? For a bit. No need to move your head, just keep it that way. I need you to trace the light with your eyes only. Right. Good job. Now look at my nose and let me know when the light appears somewhere in your vision. Good job. Now you will have to do the same thing. Just look at my nose, at my face. Just let me know where the light comes from, which side it is on, okay? Let's do it. Wonderful. Okay. Alright, amazing. Now, would you please tell me if there's any difference between these two lights? How would you describe it? This one is warmer. Amazing. Okay. Now, of course, I don't want to make you feel tired. So we're not gonna do any kind of Snellen charts or some special cards or anything like that. You'll do that during your eye exam with the doctor. But I will just check your color perception a tiny little bit. So would you please tell me what color is this? Good. What about this color? Okay. This. Right, yeah. Now let's try this. Matches the plant behind me. Right. And let's do just one more, okay? Exactly. Wonderful. Good job. Okay. Great. Now I'll take this mirror and the light, and I will just have a closer look at your nostrils, your nasal cavity, and at your mouth. Okay? Look up a little bit. Wonderful. Now open your mouth, please. Good. Have you had any any kind of bitter taste or sour taste in your mouth? I'll give you some drops. They'll help to minimize these kinds of symptoms. Please open your mouth. They actually have quite pleasant eucalyptus flavor. Very minty, very fresh. Beautiful. Okay. Now let me have a look at your ears. I don't worry, I sanitize my hands, of course. That's the rule number 1. I've actually done it before waking you up. So, okay, now your ears seem to be just alright. You had any feeling that they are clogged or something? Any kind of congestion in your ears? Can you hear me well now? I'm trying not to shout, not to make you feel stressed, and not to wake you up completely actually, but you can still hear me just fine. Okay, great. Now I'll have to take a blood test, so I will just spray some sanitizer to your forearm, back to this elbow area, and no need to worry. Okay, yeah, so you can just exactly right, yeah, you know how to do it. Okay, get in now. You see, I told you that wouldn't hurt. Yeah, it's totally fine. So I will just put it here. Yeah, we'll need to actually check the level of sugar in your blood and also some other things. Yeah, but you'll get the results, I suppose, by tomorrow's evening. So don't worry about anything of that. I'm pretty sure that everything is alright, but just in case, yeah, so we'll have to take this blood test kind of every other day. But that's alright. You can handle it, I believe in you. Okay, now let's see if you can feel the difference between some smells. I know that very often people with injuries like that might not feel any smell at all, or mix them up, confuse them at some point. So let's just see. How it works. So please take a smell. Well, what does it smell like? Eucalyptus, are you sure? Maybe you just still have this taste of eucalyptus after these drops I gave you. Drink some water. It's right there on the bedside table. Good job. Now let's try again. Can you feel the smell? Yeah, it's actually a very flower-like smell. It's rose. Yeah, you're right. So that's so much better, because you actually scared me when you said that it's eucalyptus. It's very far from that. If it was some kind of peppermint or something, that would be okay. But yeah. Okay, now let's try another one. I actually have plenty of them, but we're not gonna do all of them tonight. No, I don't want to overwhelm you. Okay. Can you feel the smell? Okay. What does it smell like to you? Blueberry. You're pretty close. It's actually raspberry, but that's quite close. And let's take one more. Take a sniff. Can you feel it? What does it smell like to you? Grape red. It's actually lime, but I mean citrus is citrus, so that will do. No worries about that. Well, take a few notes. It's totally fine. Get some rest. I'm taking everything down. I will just have to give this full report on how you felt tonight. like I said. Then there will be another nurse seeing you tomorrow, and then Dr. Eclipse will come to see you, see how you're feeling. We all really care about you, so that's why I just need to be very thorough, very detailed with my notes, so that they can compare the results. Are you alright? Bored? I'm sorry. These kinds of exams, they're not like particularly fun, but anyway, it has to be done as well. So there's nothing I can do, but I promise it's not gonna take too long. So we've definitely done a half of it for sure. Okay. Now, let's see if your hearing is alright. Well, the fact that you've heard all my instructions is already pretty good, but I will just make some noise. You'll tell me what it is. Now look at my hands. Just look at me. Look me in the eye. Just kidding. You can even close your eyes if you wish, if you want. Okay, so, are you ready? Okay. It was snapping. Exactly. What about now? More similar to clapping. Okay, exactly. Now tell me how many snaps you can hear. Almost, okay. What about now? That's right, okay. Now tell me which side the sound is on. And what about now? And now? Exactly. Good. Okay. Now, please just try to relax. I will take some of your vitals. In the first place, I need to listen to your lungs and to your heart. Yeah. Just take a deep breath in, and now breathe out. Perfect. Once again. Amazing. Once again. Good job. And once again. Okay. It's totally fine. Now, your pressure, blood pressure, I mean. I have this special device. I'm pretty sure you're quite familiar with it. Now, I'm gonna put this cuff on your arm, a little bit above your elbow, okay? Like this area. Don't worry, it's not gonna hurt. Okay, now as I fixed it, I will pump the air so that it makes it tighten a little bit. Don't worry, that's what it's supposed to be. I will just, it might feel a bit unpleasant, but nothing more than that. Okay, ready? blood pressure is okay. Do you actually have a tendency towards it being either higher or lower? Mm-hmm. No, that seems totally fine to me. Yeah, that's alright, I promise. Okay. Is your arm okay? Like I said, it's not gonna be too bad. It's not gonna be too painful or something. Let me write the results right away. Good. Are you okay? Do you feel dizzy? Are you sure? You know what? Would you please take a sniff? It will help you. Just come around. Please don't pass out. Are you okay? Are you sure? Good. Okay. Now, I will take a cotton swab and some liquid that will help you heal faster. Okay. Put it on your wound very carefully. Okay. Very careful. I promise. This side. Take some more. Side too. How did it happen to you? Oh, seriously. Poor thing. Oh, gosh, I'm so sorry to hear that. But you'll be fine. You'll recover very quickly. I promise. Okay. Here at this clinic, we are really good at it, so no need to worry about anything. Okay. Now, I need to make a little injection. Yeah, this is this kind of medicine that the doctor prescribed to you. Okay. Right, that will do. Okay. Are you ready? That's gonna be fine. Yeah. No, totally. Just relax, relax. It's not gonna hurt. Okay. You see, I told you it was very fast. There's nothing to worry about. It didn't hurt, did it? Oh, no. No, you must be kidding me. No, it can't be. No. Those injections, they never hurt. Like for real. No, no kidding. Okay. Good. Okay. Yeah, this is just some kind of medicine that is gonna help you recover faster, sooner. So that's what we all want. And I know that all these kinds of treatments, they might not be particularly pleasant sometimes. And in fact, so it can be, yeah, quite, I guess, yeah, a little bit uncomfortable, maybe even a little bit annoying. I totally get it, but we're all interested in you recovering really quickly. So that's why we just have to do that. I'm glad you understand that. Sure. Okay. Now, let's do some more sensation tests. See how your skin reacts to different kinds of tests. I have different brushes with me. Okay. So, what I will ask you to do first tell me when you can feel the brush on your skin, okay? And tell me where exactly it is on your hand. If it's on your finger, then on which finger it is, yeah? Maybe it's your forearm, maybe it's your neck, maybe it's your face. Okay, so please close your eyes. So after all, you have to sense it, not to see it with your eyes. Okay, are you ready? Let's do it. So where was the brush? Okay, good job. What about now? Did you feel anything? Okay, and where was the brush? Right, okay, exactly. What about now? Okay, great, right, yeah. And now? Good job. Okay, great. What about now? So it's right on your face, exactly. And what about now? Right on your nose. Okay, good. Now, like I have, you can open your eyes for a moment. I have these two different brushes. One of them is rather small and thin. Another one is a little bit bigger, like you can see. So obviously, you will feel them a bit differently, right? So this one is going to be more intensive, obviously. So what I will ask you to do is to just tell me which brush you think it is. Yeah? So this one will definitely give more pressure and it will cover a bigger area as well. And this one is just smaller, thinner, lighter. So you got the difference, okay? Sure. Let's give it a try. So that is this one. And that will be this one. Okay, good. So now, close your eyes. And please tell me which brush it is. The bigger one, right? Yeah. What about now? Smaller one. Okay, good. What about now? And now, smaller one again. Okay, good job. Now please tell me how many brush strokes you can feel on your face, okay? Okay, let's do it. 3 times, okay, amazing. And what about now? Just twice, okay. And what about now? 3 times again. What about now? Four times. Okay, wonderful. Now, as you can see, this sharp, there's a sharp tip of the brush, and there is softer one, and actually the brush itself. So you will just let me know if it's sharp or dull, like soft. Okay, great. So please tell me, how does it feel? Yeah, I poked you slightly. Okay, good. And what about now? Still sharp. And what about now? Okay, still sharp. Okay, good. Now, then, tell me please, what does it feel like? So that was soft. Okay, and now, soft again. And what about now? Okay, and now, good. And what about now? It was soft, but was it the same brush as before? No, it was this one. Good job, amazing. And what about now? And now? Okay, once again. Okay, good. You are doing great. So, now, let's check your reflexes. I'm not a neurologist, I'm just a nurse, but I know how it gets done. So let's give it a try. Now, I just need your knees that way. It's again wonderful. Now your wrist. Good job. Now your elbows. And your feet. Exactly. You just relax, it's fine. I'll also have a look at your chin. Awesome. No, that's fine. That's alright, that will do. Okay, now, would you please give me the widest smile possible? Good. And now frown at me. Good, wonderful. Okay, now, would you please just raise your hands like that? Please try to reach your nose with your pointing finger. Exactly. Now with the other hand, with the pointing finger, right here. Now with your middle finger. Exactly. And now with the other hand, middle finger. Oh, okay, perfect. Okay, great. Thank you. Now, let me have a look. Okay, I'm supposed to take just a few measurements. Alright, so let me have a look at your face. Okay. Alright. Now give me your hand, please. Wonderful. Okay. Now. Right. Now your feet. Just for a moment. No, just relax. It's fine. Now your shoulders as well. It's alright, relax, relax. Okay. Please let me take it down. Mm-hmm. 15, 45, 20, 1. Your neck. Okay. 17.5. That would be 12.4. And then 3. 5.1. Okay, good. Okay. Alright, in just another moment. Just need one more second. Okay. Thank you. Good. Now please look at the light again. Now once again. Now follow the light for me, please. We high five. And with your other hand. Yeah, your coordination seems to be just fine. Okay, well, like I said, I'm not here to just, state any kind of diagnosis. I'm actually not competent enough to do that, but I'm really glad that we did all these tests. I can see that you have some progress on your way to recovery, and I'm really, really happy to see that. Sure. Well, I'm really glad that all the symptoms are actually getting smaller and smaller, so you don't feel that much discomfort from them, and it's really great. So I can see that all the medicines we give you, they actually do their job, and so everything seems to be functioning better and better. Your wounds are healing, and everything else seems to be just fine. Do you have any questions to me? It's kind of late, but I can still get you something if you feel a bit peckish. Maybe you'd like to eat something, to grab a bite. We also have some tea, some chamomile tea, some mint tea, some other kind of herbal tea. You are not supposed to have any kind of caffeine right now, so I cannot offer you any kind of black or green tea. And don't even think about coffee. It's impossible for now, but I can get you some kind of herbal tea. We have some juices. I do believe that the citrus one can be a little bit bad for your stomach. And yes. But like we can get you something more neutral. I can also bring you some water. Not sparkling water though, just simple water. And I can definitely get you a sandwich. What kind of sandwich would you prefer? Okay. Well, by the way, do you feel warm enough? Maybe I can give you an extra duvet or like some kind of blanket, maybe an extra pillow so that you would feel a bit more comfortable. Yeah, I just really want you to feel comfortable enough, and if there's anything I can do for you, just let me know. Okay, great. Now that's totally fine. It's alright. It's not a burden for me at all. It's my job, and I can totally do it for you. Okay, do you have any other questions regarding your medical issues? Okay, that's wonderful. Good. Well, that's great. So, thank you so much for letting me do this checkup. I'm really sorry I had to wake you up, but I'm pretty sure that you'll be able to fall asleep again pretty soon, right? Okay, good. Also, then I'll see you soon. I believe that tomorrow at night as well. Yes. In the morning there will be another nurse, though. You remember, right? Sure. But I will tell her everything, all the results of the checkup. So yeah, don't worry. Everything is here with me. So sure, totally. Okay, good. I'll see you soon. Have a good one. Good night.